Well, thanks so much for watching Making Healthcare Work for You, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are talking about our interview with Dr. Sarita Mohanty, the president and CEO of the SCAN Foundation. I, like so many of our interviews, just absolutely love this. The time flew by. I love this conversation because it was about the aging population. The SCAN Foundation focuses on that and helping them primarily in California. But no matter how many times we talk to people, it bewilders me that the stats continue to show that people do not pay attention, care for properly, advise, consult, do anything with the aging population. And yet every statistic shows that we're living longer, which is great news. So something's working, we're living longer. But they just still don't get the consideration that they should. And I don't know what that is. I guess people just assume that you get old and it just happens, but no, you have to plan for it. So I absolutely love the work that Sarita is doing by helping to plan for these and making sure that people are getting the resources they need. She shared really compelling stats about social determinants of health, and talked about how it's about wellness. It's not necessarily just about treating an illness. It's about people-centered care. She said she wants people to be productive and vital. And I loved that. And it's just so important because that's what I want. I'm 40. I'm not old yet, but good Lord, I plan to be 100 and I don't want to just be sitting in a rocking chair in a nursing home. I want to be living this productive and vital life she talked about. So I love the work she's doing. Apoorv, what were your takeaways?
Amazing, Stephanie. You grabbed so many things away from that interview. That's why it went so fast. I think it was full of insights, and it was just so heartfelt. Also, I loved Sarita's story about her grandmother who came here from India, wound up unfortunately getting admitted to a hospital and then going to a SNF and skilled nursing facility and wasn't able to get discharged. And unfortunately, that's tragic. And it's the story of so many of our elders who wind up getting stuck in a healthcare system that isn't particularly able to understand and adapt to their needs. And it's very, very frustrating for the patients and for their caregivers, for their providers. No one really is happy with the situation. It's just that unfortunately the system isn't really designed around the needs of the older adult. Which, as she also mentioned, unfortunately, the challenges of the older adult are challenges because as people get older, they're living with more disability. It's not going to go backwards. They're living with more and more chronic diseases that you're not going to be able to unravel, even though you try to prevent and do the wellness things that you were suggesting, Stephanie. Unfortunately, these things are going to progress over a period of time, and it makes the care very complex. So we all understand the challenges. I think it's a breath of fresh air that Sarita's working on things like a master plan for California that could help the whole community, the whole state, start to prepare better for how do we take care of older adults. I was thinking actually maybe we all should have our own master plan for ourselves and for our family members. It's sort of like a healthcare proxy, but not quite, because that really only wants to think about the end of life. Maybe we should all be starting to think a little bit earlier about how do we want to age more gracefully and what are the supports we can put into place. So very thought-provocative interview, and I'm really grateful we had the opportunity.
Yes, it was a lovely conversation. I like your idea about a plan for ourselves. And if you haven't watched the interview with Dr. Sarita Mohanty already, please go back and watch it because it was great and had a million tips for everybody. Thanks so much. And we'll talk to you soon. Bye-bye.